Are we wasting our time by focusing on high drug prices when the real issue is non-optimized prescribing? Today's guest makes a compelling argument that taking into account genetics and other factors can lead to dramatic cost savings and better safety. Welcome to Health Biz Briefs. I'm David Williams, president of Health Business Group, here with Travis Morgan, president and chief financial officer of DecisionRx, which optimizes medication therapies. Welcome, Travis.
Hey, David.
Why do medications fail?
Well, not surprisingly, it's complicated. There are myriad reasons any given drug might work fine for you and not for me. But part of our platform is that we look comprehensively at as many of those risk vectors as we can. We look at 9 different distinct reasons that a medication might fail. One of the biggest and least engaged is pharmacogenetics, just the differences in how people metabolize drugs. So we look at PGX risk, but importantly, we put that in the broader context of drug-drug interaction risk and therapeutic duplication among drugs, contraindications with disease or with age or with lifestyle or gender. So we look comprehensively at all those different risk vectors to make recommendations on smarter prescribing decisions.
I hear PGX, it sounds like an oxymoronic movie rating scale, but I know it's pharmacogenomics, so that's a good one. There's so much focus on drug costs, so a huge emphasis all the way at to the presidential level, all the way down to Joe Sixpack. Why do you focus your value proposition on the total cost of care instead of medications, which is a kind of more obvious focus?
So it turns out the data show that the cost of medication failure is actually 30 times as large as what we spend on medications that work. So at the end of the day, the most expensive drugs are the ones that don't work, regardless of what the price per pill is. And it's super easy to measure what you're spending on drugs, and that's why it gets managed. But the medication failure is a 30 times larger problem than the drug spend itself. What the data show is that when you apply a comprehensive medication optimization strategy that includes genetics to optimizing medication therapy, you can reduce 10 to 15% of the total cost of care for patients just by eliminating the drugs that don't work and replacing them with ones that do. There's probably no other clinical intervention I'm aware of that comes even close to the breadth and depth of impact that simply getting people on the right drugs can have.
So what is medication therapy optimization in practice, and is it actually achievable?
Yeah, so we define MTO really as 4 things. It's firstly a comprehensive medication review delivered by a clinical pharmacist, informed by genetics, pharmacogenetics. And fourth, it's delivered in a value-based care model such that the economic incentives are aligned, and doing the best thing clinically for the patient is also the most cost-effective thing for the payers and the providers. And so that's MTO, is those 4 things.
Sounds good. In consulting, I'm used to 3 things. So the 4 is, I think, a bonus, but it's good to hear that. And I'm looking forward to having MTO come to my friendly neighborhood physician office, which hasn't happened yet. So I'll stay tuned for that.
Just a matter of time. It'll be there soon.
Well, that's it for the latest Health Biz Brief. If you like what you hear, check out my Health Biz podcast for a full-length interview with Travis about his life and career. Travis Morgan, president and CFO of DecisionRx, thanks so much for joining me today on Health Biz Briefs.
Thanks, David. Take care.